Therapeutic exercise is the cornerstone of what we do. It's the active ingredient in physical therapy. Think about it for a second. We use our hands, we use modalities, but it's movement that truly empowers our patients. It's the tool they take home with them. It's the skill they build that lasts a lifetime. When a patient masters a new exercise, they aren't just moving a limb. They are reclaiming a piece of their life. They are taking back control from pain, from injury, from limitation. This is why we do what we do. It's about more than just reps and sets. It's about restoring hope and function, one carefully guided movement at a time. It's an incredibly powerful process to witness and to facilitate. Strength is the ability of a muscle to exert force. It's that simple. It's about pushing, pulling, lifting, and carrying. In the context of rehab, it's about giving muscles the capacity to support our joints and perform daily tasks without strain or injury. When a muscle is weak, other structures have to pick up the slack. This can lead to compensation patterns, joint stress, and chronic pain. Think of strength as the structural support for the house that is our body. Without a strong foundation and sturdy beams, the entire structure is vulnerable. Building strength is often the first and most critical step in protecting the body and enabling its recovery. Strong muscles act as natural shock absorbers. They protect our cartilage and ligaments from excessive wear and tear. For a patient with knee osteoarthritis, stronger quadriceps can offload the joint, reducing pain and improving function. For someone with low back pain, strong core muscles create a natural corset, stabilizing the spine during movement. Strength isn't just for athletes, it's fundamental for everyone. It's what allows an older adult to stand up from a chair independently. It's what allows a warehouse worker to lift a box safely. It's the foundation of functional independence. Flexibility is about the length of a muscle. It's the ability of a muscle to stretch. Mobility is about the joint and its available range of motion. You can have flexible muscles but still have poor mobility if the joint capsule or other tissues are tight. These concepts work hand in hand. We need both to move efficiently and without pain. Think of a door hinge for a moment. If the hinge is rusty, meaning poor joint mobility, it doesn't matter how freely the door swings. The door just won't open properly. Our job is to de-rust the hinge. Limited flexibility and mobility force the body to compensate. Tight hamstrings, the lower back might round excessively when they bend over, leading to back pain. If an ankle lacks dorsiflexion, the knee can collapse inward during a squat, stressing the ACL. Restoring normal movement patterns is impossible without adequate mobility. Mobility is a prerequisite for strength training and functional activity. By improving flexibility, we reduce muscle tension. We decrease stress on joints. We lower the risk of muscle strains. When teaching flexibility, safety is paramount. The mantra should be, stretch to the point of mild tension, not pain. Pain is a signal you're pushing tissue too far, risk of protective spasm or micro tears. Static stretching, hold for about 30 seconds, is a great starting point. Instruct patients to ease into the stretch slowly and breathe deeply. Avoid ballistic stretching. It can increase injury risk. Endurance, or stamina, is the body's ability to sustain prolonged physical activity. It's not about maximum force, it's about sub-maximal effort over time. There are two main types we deal with. First, there's cardiovascular endurance, which is the efficiency of the heart and lungs to supply oxygen to the body. Second, there's muscular endurance, which is the ability of a specific muscle or muscle group to perform repeated contractions against a resistance for an extended period. Both are crucial for recovery. Think of endurance as the battery life of the body. A patient can have a strong engine or strength, but if their battery dies after 5 minutes, they won't get very far. After an injury or surgery, patients often experience a significant decline in their overall fitness. They get deconditioned. This can lead to fatigue, which becomes a major barrier to participating in therapy and daily life. Improving cardiovascular endurance helps the body deliver oxygen and nutrients to healing tissues, which can accelerate the recovery process. Improving muscular endurance is vital for tasks that require sustained effort. Walking, climbing stairs, carrying groceries. For a patient with chronic low back pain, building endurance in the deep spinal stabilizers allows them to sit or stand for longer periods without discomfort. Teaching endurance exercises safely means starting low and going slow. Use the talk test and heart rate monitoring, often 50 to 70% of max, to find a sustainable sweet spot. Balance is the ability to maintain your body's center of mass over its base of support. It's a complex skill involving constant communication between our eyes, inner ear, the vestibular system, and proprioception. Proprioception is the body's awareness of position in space. It's the network of tiny sensors in our muscles, tendons, and joints that tell the brain where limbs are. Stand on one foot and close your eyes. That wobbly feeling is proprioception working overtime. Balance isn't something we think about until we lose it. It's the quiet, unsung hero of confident movement. After almost any lower body injury, ankle sprain, knee ligament tear, hip replacement, proprioception is impaired. The joint-to-brain communication gets fuzzy. That's why an ankle can give way months after the sprain healed. For older adults, balance training is even more vital. It's the #1 defense against falls, which can have devastating consequences. Safety is the absolute priority when teaching balance. Always create a safe environment, near a wall, sturdy countertop, or parallel bars, with contact guard. The key: systematically challenge the system. Narrow the base from feet apart to together, to tandem, to single leg stance. Change the surface: firm, foam, wobble board. Alter sensory input: closing the eyes, turning the head. For an ankle sprain, single leg 30 seconds, then foam, then ball toss. For Parkinson's, tandem and grapevine walking. For post-op knee, side-to-side weight shifts. A truly effective therapeutic exercise program is more than just a list of exercises. It's a symphony where strength, flexibility, endurance, balance, these 4 pillars, are deeply interconnected. You can't build functional strength if a joint is too stiff. You can't work on endurance without stability. You can't challenge balance if muscles are too weak. Think of building a house. First a solid foundation and square frame, mobility and balance, then walls, strength, and the utilities, endurance. Address the most pressing limitations first, but always with an eye on the complete picture. A session might begin with gentle mobility, move to core strength and stability, and finish with light cardiovascular work. For a 45-year-old office worker with chronic low back pain, cat-cow and hamstring stretches. Then bird dog, planks and bridges to build a muscular corset. Build core endurance with timed holds and add a daily 20-minute walk. Integrate balance with single leg stance and a light band palaf press. The home program mirrors this: a stretch, a core exercise, and a balance challenge, short, specific, and doable. First and foremost, be an exceptional educator. Explain the why behind every exercise. Example: a glute bridge teaches hips to work instead of the back. Use simple analogies. Draw pictures. Make it stick. Master progression and regression. Make it relevant to goals. Be a coach and a cheerleader.